Malignant hyperthermia derives its name from hyperthermia, which is high body temperature, and malignant, which means bad.
Malignant hyperthermia is a genetic condition that when a person is given certain types of anesthetics, their body reacts in a certain way.
The problem with malignant hyperthermia is that you cannot tell from outward appearances, the so-called phenotype, whether a patient is at risk for malignant hyperthermia.
Unfortunately, some of our best drugs, the drugs we use most commonly and are best for most people, are the ones that can trigger an MH reaction.
They can have an elevation in body temperature, their muscles contract, they start sweating.
Once the syndrome begins, it can progress very rapidly over a course of 15, 20, 30 minutes. And you can go from a normal body temperature to a body temperature that causes irreversible damage.
Anesthesiologists and other anesthesia care providers refer to this as their worst nightmare because there are so many things happening at once. The patient is in a critical condition and it must be turned around within minutes. Within 15 minutes, that patient can die. MAJUS is a patient advocacy organization. We are here to educate, to prevent MH, to promote research into the MH and other related disorders, and to share our information as broadly as possible.
The primary aim has been to provide information, education, and a source of expert knowledge in dealing with this syndrome.
MH is a crisis that is best prevented by preparation. So we drive that premise forward, and that's how we deal with it. We try to talk to the drug companies, the equipment manufacturers, and help them to understand that they need to help us educate so that we can stop deaths.
We regard ourselves as being there for people when they need help, guidance, information in dealing with the problem.
There are two ways to help determine if somebody's susceptible to malignant hyperthermia. One way is through a muscle biopsy where they do contracture testing. The other method of testing is a genetic test. The people we would recommend doing genetic testing for would be somebody who has had an MH episode, somebody who's had a positive contracture test, somebody who has a family member with malignant hyperthermia.
When you identify a specific mutation in a family, you can then go and test for that mutation in other family members. And so if the other family member has that specific mutation, you can tell them they're MH susceptible. We receive about 2 million hits a year on our website.
Whether you're a medical professional, a patient, or just want to know information about MAJUS, you've come to the right place. We provide information on our hotline, our educational materials, and our preventive measures that are available to you. We have a caffeine halothane contracture test or the muscle biopsy on our website so people can see an actual muscle biopsy, and a message board where you can talk online with other people that are suffering from MH or have MH in their family, and they want to share what they've experienced. The MH Hotline group is a special group. Those doctors that are involved with the hotline give of their time at a 2-week increment, 24 hours a day, 7 days a week.
When there is an episode and there is a question, there is immediate availability of an expert on the line so that you can describe what's going on and they can give advice.
The pager goes off or your cell phone rings. It's M-House saying, we have somebody calling from whatever state it is. It could be anywhere in the country or sometimes out of the country. They have a patient having this problem. Are you able to help them? Sure. So they say, just a moment, they connect you, and in 30 seconds, that caller is talking to you.
When you're dealing with a syndrome that can progress over 10 minutes from a normal baseline to an extremely high temperature and cardiovascular collapse, it's every second counts.
The Registry is a repository of data that we get from patients who have had or may have had MH reactions.
We have a wealth of information about the clinical presentations of malignant hyperthermia and the test results as well. And so, like any other registry, it's used as a source of data mining to learn about the presentations of malignant hyperthermia.
In the registry now, there are about 3,000 reports of muscle contracture testing. And if the person agreed to be a research subject in the registry, then it has their name and other information about them. And we write back to them periodically to be sure we stay in touch with them. I think it's a major resource for further understanding, because the families that are registered are the source of the development of the genetic testing and for future improvements in that, and also for a better understanding of the impact of this condition on their daily lives.
When you're in a hospital situation or a surgical situation, it's not necessarily the anesthesiologist or the CRNA who talks to that patient, it's the nurse.
The nurses are dealing with patients all the time in the operating room. Surgeons come and go. Anesthesiologists may come and go. But nurses regard themselves professionally and properly so as guardians of the patient, as well as playing a role in patient care. So the operating room nurses and the ambulatory surgery nurses have a very strong interest in delivering high-quality care.
We're there for the nurses. Their focus is our focus. They are the driving force behind making sure that these programs are in place, and we are there to help them do that.
One of the goals of the organization is to get at least the information about malignant hyperthermia out there in many different languages so that other practitioners can be aware of this syndrome, at least how to recognize it, and if possible, treat the syndrome as well.
One life lost to MH is one life too many. Our goal is to have 0 deaths from MH, and until that can be guaranteed, our job is not done. We'll continue to work toward that goal.